USMLE style question, thymus derivatives. A 6-week-old infant presents with a history of recurrent respiratory infections and failure to thrive. Physical examination reveals short stature, low set ears, and a cleft palate. The infant also exhibits hypocalcemia and recurrent infections. Laboratory studies show a decreased T cell count and a normal B cell count. Genetic testing reveals a deletion on chromosome 22. Which of the following is the most likely cause of this patient's symptoms? A. Failure of development of the third and fourth pharyngeal pouches. B. Defect in the migration of neural crest cells. C. Abnormalities in the development of the mesoderm. D. Defect in the fusion of the first and second pharyngeal arches. E. Impairment in the development of the ectoderm. Answer: failure of development of the third and fourth pharyngeal pouches. Explanation: this infant's presentation is highly suggestive of DiGEORGE syndrome, a congenital immunodeficiency disorder associated with a 22q11.2 deletion. DiGEORGE syndrome is characterized by hypocalcemia due to parathyroid hypoplasia, defective development of the third and fourth pharyngeal pouches, thymic hypoplasia or aplasia, leading to T-cell deficiency and increased susceptibility to infections. Cardiac defects, e.g., conotruncal heart defects, such as tetralogy of Fallot, cleft palate, and facial dysmorphia, e.g., low-set ears. The thymus and parathyroid glands derive from the third and fourth pharyngeal pouches, and defects in their development lead to the clinical features seen in DiGEORGE syndrome. Why other choices are incorrect? B. Defect in the migration of neural crest cells. Neural crest cells give rise to structures such as the craniofacial bones, nerves, and melanocytes. While neural crest migration is disrupted in some conditions, e.g. neurofibromatosis type 1, it is not the primary issue in DiGEORGE syndrome. C. Abnormalities in the development of the mesoderm. The mesoderm contributes to the development of the muscles, bones, and cardiovascular system, but it does not directly affect the thymus or parathyroid glands, which arise from the pharyngeal pouches. D. Defect in the fusion of the first and second pharyngeal arches. Defects in the first and second pharyngeal arches result in craniofacial malformations, e.g. Pierre-Robin sequence, Treacher-Collins syndrome, but not thymic or parathyroid issues. E. Impairment in the development of the ectoderm. The ectoderm forms structures like the skin and nervous system, but is not responsible for thymus development. Clinical relevance. DiGEORGE syndrome arises from 22q11.2 deletions, affecting the third and fourth pharyngeal pouches. Diagnosis is confirmed by fluorescence in situ hybridization, FISH, or chromosomal microarray to detect the 22q11.2 deletion. Management: calcium supplementation for hypocalcemia, thymus transplant or T-cell therapy for immunodeficiency, cardiac surgery for congenital heart defects, speech therapy and orthodontics for cleft palate.